My name is Munir Ghesani. I'm one of the radiologists with Continuum Health Partners, and our group is New York Radiology Partners. I practice nuclear cardiology, nuclear medicine, and PET-CT imaging, and I'm involved in the administration as well as I'm one of the associate program directors of radiology residency. In terms of what lifeIMAGE has brought to our institution is, because we are a tertiary care center, we get the referrals from many different geographic areas in the tri-state areas and beyond. And as a result, we are always in need for integrating the outside examinations into our practice. And so often we had this situation where, because we are in the New York metropolitan area and we have several hospitals and offices distributed throughout New York, is that once the patient brings a CD, often it would be a time lag between the time the CD gets brought in and it goes to its destination for not only the clinicians to first take a quick look, but also to ultimately send it to the referral pattern of that clinician within the radiology group for that radiologist to take a look at that CD and give the opinion. With the introduction of lifeIMAGE platform, we are able to now do this seamlessly and in a very little time compared to several hours to days that it used to take to bring those images for review for radiologists. What I like about the lifeIMAGE platform is that it works independent of the platform. So we don't need to do anything different than what we have in our setup. A specific radiologist happens to carry a Droid device that will be available to look at the images, or if somebody's carrying an iPad or let's say any other mobile device, it will provide the access to the images independent of the platform. There are many other examples, including one of our practices where it happens to be that it's a group of 5 orthopedic surgeons, and one of them is only using the iPad device for everything he does. And his particular requirement is that if he's using his EMR and everything else on the iPad, he would like to see the images on the iPad as well. So providing a solution for mobile device from lifeIMAGE, we will be able to reach out to that physician and provide him the images that he needs. When we initially adopted the platform, our needs were unique in the sense that we just not only need to bring the images over, but many times the radiologists were using it for a complete diagnostic tool. When we reached out to lifeIMAGE and we mentioned that we would like to refine those tools to replicate what our PAC system does, and lifeIMAGE staff was very open and was very willing to work with us to provide the tools necessary. And from the initial stage of deployment to now, there are so many more tools added onto the lifeIMAGE platform that our radiologists are also very receptive of the idea that if they provided us the feedback, they were able to get what they were looking for. We had put forth a specific set of requirements that we had, things that needed to be done quickly and outside of the traditional format of long communications and emails. Often we were able to pick up the phone and let them know that these are the things we need. And our turnaround time for these requirements to be implemented was really, really short. And I know the staff has gone out of the way to bring for us what we needed in bringing the lifeIMAGE to our implementation platform.